Our first panelist this evening is Sara Sahba. Sara is a pediatrician in training and co-founder of two nonprofit organizations. The first is the National Expertise Center on Health and Healthcare, called EKANN in Dutch, that offers advice, signals issues related to migrant children, serves as a network for healthcare providers, and provides education for other healthcare providers in the Netherlands. In addition, she's also one of the co-founders of Radix, which is a communication platform providing training for open and inclusive communication to healthcare practitioners as well. Our second guest this evening is Hussain Jafari. He's a psychologist, educator, project manager, translator, and interpreter, amongst many other things, and is coordinator of the Life Skills program at the Dutch Red Cross. And our third guest speaker this evening is Marti Castaner, a clinical psychologist, associate professor of public mental health at the Center for Migration, Ethnicity, and Health at the University of Copenhagen, who studies intergenerational mental health with a specific focus on immigration, migration, and motherhood. All right. So 3 speakers who I think have a lot to share with us and a lot of insights regarding these 3 films, which touch on a lot of their areas of expertise and their interests. I'm going to go ahead and start with a question for Sara. So I was wondering why, perhaps, I'm going to go ahead and start with this proposal, that these films are relevant and perhaps even necessary viewing for healthcare professionals in the Netherlands. Would you like to go ahead and answer that or respond to that proposal of mine? Why are these so necessary?
Sure, Megan. Thank you so much for a wonderful question. I think that these 3 short films, each focusing on different timelines of the migrant experience, and especially those that have not chosen voluntarily, but were like actually due to their circumstances, actually brought to the decision to move countries and also to go on to start a new life somewhere else. So these 3 movies, they show us perspectives of the migrant experience, and also what it implies for their health, not only mental health but also physical health, being exposed to risks as young people, physical risks, but also mental health risks of feeling lonely, feeling helpless, um, and to be detached, of course, from everything that you know and the impact that it has on your experience, and also your ability to seek help or healthcare. So I think it gives a really good insight into the human experience that is facing, and also well, actually directing how people are able to take care of themselves, or maybe are pushed into not being able to take care of themselves because of the circumstances that they are in sometimes.
That's a great answer. Thank you. I think that gives me a great link then to the question I'd like to ask Hussain, because these films depict, as you mentioned, Sara, people in vulnerable situations, so people who are powerless or maybe even under the control of others. And I was wondering how the Life Skills program at the Dutch Red Cross addresses these problems. Are there any things that you're doing to help empower people who are in these positions?
Um, I would say migration is a mental crisis, and it happened throughout the migration process. It's not one point. From the beginning, on the way, and when the people reach to the destination, and even after they got their residence status, after they learned the language, after they've gone through all the problems, the mental problem, the mental crisis is still there. So, these 3 films showed it really well, how profound is this mental problem. Red Cross, the project that I work in is a mental health support program through workshops. We provide mental health workshops to the migrant, different categories of migrants, undocumented migrants, asylum seekers, status holders. Even we provide the workshops to the migrants who are in the detention centers. These workshops are basic mental health concepts, and the goal is to empower the migrants to enable them to protect their own mental health. The workshops are about how to manage your stress, clear communication, how to set goals in your life, um, how to deal with your stresses. So we do, through these workshops, we help the migrants to, because they deal with lots of stresses. Migration is a mental crisis because you deal with multiple stresses at the same time. If the stresses is one by one, it's easy to deal with. But when you're a migrant, you should deal with loneliness, with uncertainty, with financial problem, with the new culture, new language, loneliness, with everything at the same time, and that makes it crisis. So we try to help through the workshops, help the migrants to learn how to identify the symptoms of the stress, and then learn the new coping mechanism, grow new healthy habits to deal with them.
It's a wonderful initiative. And I think that workshops like that can help, like you said, empower individuals to manage and deal with what they're going through. And as you mentioned, it's an ongoing thing. It's not like it ends and they're
Indeed.
continuing uncertainties. That links me then to the question I want to ask Maria, because I know part of your work is about unstable housing and the impact that has in the short and long term. I was wondering if you could link perhaps the film depictions of on housing in film 2 and 3, so that would have been the film Swedish Speaking Migrants in Paris and Game Over, to your own experience as a clinician and as a researcher.
Yeah, thank you, Megan. And I hope there's not too much sound on the background. Yeah, I mean, we do know that the life circumstances and actually what happens once they've arrived to destination or in this, transit period, it actually affects their well-being and their health in many different ways. And not being able to have housing and a place that allows you to be safe is one major stressor for anybody, but even more so when you're in this transit journey, and also once you have arrived in your destination, but you're sort of like waiting to find a place to live. So in that way, when we think from the perspective of healthcare professionals, mental health professionals, or doctors that are providing health support or advice, when these basic necessities are not covered, it's also really hard to provide any additional support, right? And I think that's sort of like, it's a good reminder of how some of these structural problems are actually one of the main causes of this distress and this poor health, right? And these are namely, injustices. And I think that in a way, in the second film, one of the Swedish women said, the system is breaking them. And I think this is a good example of how something that is so fundamental as having, stable housing, just does not allow you to even pay attention to other things about your body, your own health, or your mental health, because you don't have these main necessities covered. So that's also a call to, both governments and politicians to also, think about and reflect on the migration systems they've put in place, really.
I wonder, Sara, what your experience is as a pediatrician with this, what Maria was just mentioning about the stressors on an individual or maybe even a family system. Are there additional aspects that you've noticed in addition to unstable housing when you're treating migrant children in your practice?
Well, I would say that a lot of it is like the mental load of all of the stressors that are that people that have to start a new life or are on the move have to deal with. So, for example, if we talk about the system in the Netherlands where migrant families are being moved around a lot, it brings a lot of loss of autonomy, or actually having the feeling that you have something to say in your own life. Sometimes the facilities are also not ideal for families with children. This could also mean that their development is negatively impacted. Think about school, think about child-friendly surroundings, risks. I mean, we know that the number of refugee children that drown is way higher than the number of Dutch-born children that were drowning in the Netherlands. It all has to do with how much of an eye is open and out for the risks that they are imposed to, and also, of course, the mental load that is there on their caregivers. So I would say that there is multiple stressors, and one of them is probably also the fact that they don't feel like they have the capacity or the mental space, headspace, to take care of themselves and advocate for themselves, or at least they're not put into empowered positions to do so. Because if you ask them, I mean, we did a research, my team, my colleague Albertine Bausch, she did a wonderful research asking parents of migrant families in asylum-seeking centers here in the Netherlands themselves, what would you like for your child? And all of them, they said, we want our child to have the best health possible. We want them to be checked. We want them to be seen by a doctor. Also, this was the case for the migrant young, the unaccompanied minors that were in the refugee centers. So they all want to advocate for themselves, but we're not giving them the tools to do so. And part of it is the mental health load, but I think there's also many other stressors that have to do with the system that we put in place for them.
I think that links to another area of interest of yours, Maria, that you just mentioned about, intergenerational mental of their children. I was wondering if that's something you've encountered in your work as well, but also perhaps what parents then give intentionally, unintentionally to their children due to their own experiences of migration.
Yeah, thank you for the question. I think that's a really good, important question, but also hard to answer, that needs a lot of nuance. So I think, first to say that we know more and more that stress, and the stress, for example, that women might experience during pregnancy, but also after giving birth, can have these effects on the bodies and minds of children, right? And we see this sort of like for everybody, right? There's something about these exposures in utero, and then what happens afterwards, that also allow parents to be more or less caring based on everything and that they are experiencing, and also, as Sara was saying, this mental load. So we know that this is something that happens to everybody, but as we saw in these films, families or people that have migrant backgrounds that might go through these experiences, and some we know, for example, that might be women that are pregnant, right, during their pregnancies or after giving birth, they are more exposed to some of these stressors and overloads that can produce more stress. So I think that's sort of like the first thing to consider, right? That they might be more exposed to these stressors. And then I think it's quite important also to reflect about, what it means, as in the first video we saw, right? To be in a place where you might not always feel actually welcome, where you might be sort of like forced to choose this identity, and what does this do for the next generation? And I think I was thinking a lot about the first film, because it made me think about, the position in which sometimes parents are put in, right, where they need to choose between these two identities, as if we couldn't hold, having both identities, and then, therefore, to make sure their kids are integrated or well received, or they adapt well, then they just, put as much effort as they can to give these experiences, but that also means that they might have to sort of like forget that other identity, that other culture, and that other background, with what that means for parents themselves. So I think in that way, it's also, again, important to reflect about, what spaces we offer when we welcome migrants, people that come from other countries, that become parents in a different country, to hold these different backgrounds, right? And sort of like pass on to the next generation. And again, I think the three films also show really the hope and the strength of all of them, to have a good life, right? And to try as hard as they can. So I think, again, it's another invitation to think about, what systems we put in place to actually help them, support them once they have children in this new country, if they do, to provide them with the best support possible, right? Because it's not that families don't want that. Often is that, they are experiencing a lot of pressures. And we also know that often migrants, they experience actually even more stressors after they've arrived to their destination than before. So I think that's, again, also a good reflection about the systems that are put in place, right?
Yeah, that's a great answer, and it leads to a lot of links. I want to ask one to Hussein, and then I want to give you the floor, Sarah, because I can imagine there's some links that you want to make there as well. Hussein, what Maria just mentioned is choosing between identities. I wonder to what extent that's part of your workshop. Is that something that you notice that the participants are struggling with in the workshops that you facilitate, and is that something that you explicitly address?
The effects of migration is so deep that it affects even the core values, core identity of the person. The first film, we saw that the lady had a house, was well integrated, but still was not happy, because still was struggling with I should show a smiley face to the people that I want to belong. So it means that she was trying to hide her identity. She was struggling with the identity, which identity to choose. So and this struggle is as a result of multiple traumas that people, migrants, get during the process of migration. We talked about the intergenerational effect of this migration. In the last movie, they were all Afghan teenagers. Most of them were living in Iran. So their parents migrated to Iran, were living there for many years, and then these teenagers were migrants, second generation migrants, and then still they didn't feel belong. They feel rejected. They didn't feel belong. So they were in the process to migrate to Europe. So you see, they might get to Europe. They might find a home in Europe, but the effect, the feelings of rejection, the feelings of anxiety, not belonging, anger, those feelings from their parents, from their own experience, will be with them for their whole life until they get proper help. And that's emphasize the good, the importance of providing psychosocial support for migrants so they can be healed. One of the in the second movie, one of the boys, his name was Hope. Omid in Farsi, in English is Hope. And then he spoke about I want to be this, I want to have a good life. But, they have lost their hope over and over. In every game, they lose and they they feel hopelessness. They break down, and then they try again. They once tried it in Sweden, and then they break down. They was rejected. They came to France to try it again. You can how many times you can have the energy to start from zero? It takes a lot of energy to start over, and every time you break down, it's like a glass that is break down and recovered, healed, and is broken down one more time, again recovered. But the third time, that glass will not be the same.
Yeah, good points. And it reminds me, Sarah, of the conversation we had before this, talking about what resonated with us. Hussain and Maria, if you want to talk about the films that resonated with you personally, afterwards, after I give the floor to Sarah, please feel free to. But the first film resonated with you. Would you care to share that? And I think that links to the comments just made.
Yeah, of course. So I really attest to what Maria and Hussain say, that migration in itself is a mental crisis, and it leaves its marks even on the generations that come after the generation that migrates. So as a child of migrants, I can fully recognize the struggle that the woman in the first movie is portraying to us, because it's something that has such a deep impact on your identity and on your development as a human being, that your children will always carry that feeling, even if they haven't personally gone through it.
The first one and the first movie was touching. How when the lady talked about the effect that her migration had on her identity. She said, I don't know, I'm Iraqi, I'm Danish, who am I? So people come to a new country, face the new language, a new people, new culture, and they want to make a new life, but it's not easy for them to cope. It's difficult for different people to cope. For younger children, it's easier, but for older adults, it's really difficult, because they have their personality, their identity is shaped, and it's really difficult. It is coping is not about changing your identity. It's about going with the flow. But when you are a migrant, the reaction that you get from media, from people, from the government, you feel that you have to change your identity to cope with the new situation, with the new environment. It's really difficult to learn a new language. In the second movie, they tried hard to learn Swedish. Oh, it's really difficult. But now they have to leave that language and learn French. That's really difficult. So it was really touching for me, because I am myself a migrant in Netherlands. I'm from Afghanistan. I'm a migrant in Netherlands, and yeah, it showed me how difficult it is to cope.
Thank you.
Thank you, Hussain. I think it's hard to choose for me for two reasons, but I mean the first movie happens in Denmark, and in one of my research projects we are actually working with Diversity Works, which is the organization that supports people with migrant backgrounds in Copenhagen, where we work. So I have a very close relationship to them, and I think what resonates about this movie with me, that also relates to the work that we do, is that especially and particularly migrant mothers or mothers that have migrated, right? We have so much to learn from them, and also like we have to be reminded that becoming a mother by itself, it can come with a lot of pressures and a lot of worries, and we ask a lot from mothers, but as one of the mothers that we interviewed for one of our projects said, when you are a migrant mother, you are not asked 100%, you're just asked 200%, right? And I think that brings me back again to this question of how much we are asking from people that come from other places, that have other backgrounds, that if in the case of motherhood by itself, it is a change in your life and you have to adapt to just being a mother in a different country. Again, it's 200% that you often have to show to society, right? And this idea that you always have to show that you are worth given, like having even this opportunity to live here, which it can be quite exhausting. And I think that also brings me to the second film, which it also resonated a lot with me, because I've had many conversations with some people and colleagues, sometimes in Denmark where I live, where they looked at Sweden, our neighboring country, right? And they look at Sweden as the example not to follow. They think often that they open their doors to too many migrants, things are not going well there. And I think this second film should be shown to everybody, to actually also show that is the system sometimes that after people have spent a lot of time learning the language, trying to be part of it, trying to build a life, then rejects them, and what that means for human beings and for trusting each other. So in a way, I would also like to challenge this idea that we sometimes see migration as a mental crisis. And I understand what you said, Hussain and Sara. It definitely comes with a lot of consequences, and we see many migrants suffer. But I think we can also see migration as actually something that brings a lot of positive things to our societies, and that it might be often, or it could be that it's actually, the structures we have in place, what is asked from migrants that also causes a lot of suffering, right? So we can also, see all the strengths of migration, which is something that we've been doing all our lives, and society and humanity for years and years and years, right? So, yeah.
I completely agree with you, Maria, because I think that just deciding to move and to start all over, it showcases so much strength, and I think that one of the ways that it could be be resulting into a positive experience is if we actually enable people to make sure that they can take care of themselves and their mental health in such ways that they are not traumatized just by being a migrant in a new country. Unfortunately, right now, I see that in the Netherlands, for example, we are traumatizing people over and over and over again, even after they've arrived. So I think a lot of the traumatization after arrival in the host country is due to the system that we have created here, and we are also holding up for too long. It's been outdated, in my opinion. Yeah.
I
think
really
that
agree.
links to a question that Morten asked in the chat. So what would be your advice? So that's maybe one tip to give. So what could you also do to support migrants in obtaining better health and well-being? So one would be fix the system so you stop re-traumatizing them. But I wonder if you have some other thoughts as to what could be practically done.
Well,
May I go first?
of course.
One solution is what I am doing right now, providing social support to migrants. Our work, what I'm doing is these workshops are given by volunteers. We have a network of 70 volunteers all around the Netherlands, and these volunteers are student psychologists, retired psychologists, people who work in medical care, who have a background in medical care, and we train them, and they do the workshop. These workshops are make a safe space for the participant migrants to share their stories, to express their feeling, their stresses, and then within the workshops, we try to help them to learn from each other. They support each other, and then they learn how to protect their own mental health. It's really important to find a way to provide these preventive. The workshops are not treatment. These workshops are just preventive measures that gives information, provide some tools for migrants to protect their mental health themselves. So that is, I think, one of the best solutions.
And I agree. I think that the circumstances in which people are living right now, they're not always suitable to actually provide optimal preventive healthcare services, if you ask me. So, for example, something as simple as vaccinations for children or adequate obstetrician care, antenatal care. These preventive services are sometimes suboptimal because of the system that is in place in the Netherlands. But I know that in a lot of other European host countries, access to care is very minimal, or it's endangered. So I would say that access for people to actually seek help when they need it is also very, very important. Next to, of course, basic services, such as adequate and stable housing, right? Like Maria also stressed earlier.
Mm-hmm. Yeah, I think I agree with both of you. I think I would just add two more points. I think there's something about the temporality of residence permits that brings so much uncertainty, right, into one's lives that needs to be revised. So, when every 2 years or a year and a half you have to be renewing your residence permit, that creates a lot of uncertainty and unnecessary stress. So that would be, a very hard thing to change because it's very political, but I think a very important one to revise. And then I think, in the case of the first film too, we could see that civil society plays a very important role, right? So working more to create these spaces where we can come together, where we allow different, both organizations, but different parts of society to know each other, to see that Denmark it can be for many different people with many different backgrounds, and that we can all have a place. So it might sound a bit naive, but I think we really have to work towards understanding what this diversity means, right? Mm-hmm. That you can be Danish and also Iranian and also Afghani and also, so really get to know each other better. And examples like Diversity Works or other social organizations that work with that idea behind, I think, show the potential of these kind of spaces.
Yeah.
I think this conversation has actually answered some of the other questions that participants have posted, namely about how the Dutch system is responding to these diverse challenges. I think, Hussain, your work is perhaps not part of the Dutch system, but officially, but is actually a great service to the system. We also had a question about how we can bring human stories into policy and practice. And I'm hearing that kind of that in your responses already sort of an answer to that. I think maybe we could sort of go to ease toward the ending or closing of this panel discussion. But I would like to ask the three of you, is there anything that you'd like to say in addition, or something a thought that's left unanswered, or a question you'd like to pose moving forward to participants in this session this evening.
I just want to say that I really thank you for bringing together these 3 films. Actually, I think this offers such a good opportunity to tell the stories, right? So I really hope that you keep doing this, but also keep bringing these stories to other places. Also show them to people that perhaps are not in the room right now, right? But that they could also learn so much from engaging with them, because they really make a difference, and they really help you to see, you know, what it could mean to be in their position. So thank you for that.
Yes, I agree totally. And I think that it's such I see so much growth potential and also inspiration with the group of individuals that has been working on these films, but also all of the people that have taken the time to view these films right now, because it means that they are actually interested in the human experience and not the numbers and all the negative attention that is going on throughout Europe right now for this group of people. So it fills my heart with joy. Thanks.
I would like to emphasize, in my idea, in my opinion, could be a good solution, is the culture of volunteerism. Yesterday, I read in the news that more than 50% of Dutch people do one sort of volunteer work. Volunteer is a great thing. I've seen it a lot, really helpful to the migrants. It gives, for example, you volunteer to be a language coach for migrants, to just go visit them in their asylum camp and talk to them, take a city tour with them, do something for asylum children, migrant children. So already the Dutch society has done a lot through volunteer jobs, volunteer work to help migrants. And I think that's a great solution that gives the migrants a feeling of belonging. You belong here. The feeling of acceptance, a feeling, provide a listening ear, provide some sort of support, small, but that matters a lot.
Hussain, I couldn't have imagined a better end. A final comment, because I think that that's one way, in light of these films, which are sad and touching and moving, but can also maybe make us as individuals feel disempowered when watching them in terms of what we can contribute to what is a broader systemic problem. I think what you offer in your comment in terms of giving your time in the variety of voluntary options that there are available in various countries to support migrants, children, families. I think that's a really heartening bit of advice. Thank you. Thank you, Sara, Hussain, and Maria, for this wonderful and enlightening panel discussion. It was a great pleasure to be able to moderate this, and I look forward to future conversations with all of you. And I would like to remind participants here that you can get more information about our film events for the Dutch Global Health Film Festival, for the Kenniscentrum Global Health, and the Global Health Film Days in Copenhagen. There'll be a link once our images are from the screen, and a QR code. So please stay in touch. You can find us on socials and online, and you're welcome at our following events.
Thank you, Megan. Thank you, everyone.
Bye-bye. Good evening.
Bye-bye.